Hi, my name is Emily. I'm a family nurse practitioner student, and I'm here today to do a cardiovascular assessment. Can I go ahead and have you lay down on this pillow, which puts your head at a 30-degree angle? Okay, I'm going to begin by inspecting your chest for any thrills or heaves or abnormal heart pulsations that would indicate any kind of cardiovascular dysfunction, and none are noted. Now I'm going to inspect your chest for your carotid and jugular pulsations and your jugular venous pressure. So if you can go ahead and turn your head that way a little bit, I'm going to palpate on the off of your midline here, and I'm going to palpate your carotid pulse in the lower third of the carotid with my 2 fingers. And I'm not feeling any bounding or any weakness or threadiness to the pulse. It's a normal palpation with a regular rhythm. Go ahead and turn your neck to the other way. I'm going to feel on the other side, the lower third of the carotid, and in the same fashion. There's no bounding, no weakness or threadiness, and it's a regular rhythm. There are no rhythm abnormalities palpated. Go ahead and turn your neck again to the left. I'm looking for your jugular venous pressure. I'm looking at your external jugular vein, which lines up approximately with your ear line. See it right here. I'm going to measure your jugular venous pressure by putting this ruler at your sternum like this, and putting this piece of paper from where I can see the pulsation and measuring it at about 3 inches, which does not indicate 3 centimeters. Which does not indicate any right-sided heart failure, which is what the jugular venous pressure indicates, because it sits right above your right atrium. I'm going to listen for carotid bruits on your carotid vessel. And for this test, I'm going to use the bell of my stethoscope, and I want you to hold your breath as I place the bell of the stethoscope on your carotid, and that's going to help me hear any murmurs or any irregular heart rhythm, any irregular heart sounds. Okay, I'm going to place it on your carotid artery. Hold your breath for me, please. Take a big, deep breath in and hold it. Excuse me. Okay, go ahead and turn your head the other way, and now listen to your other side. Thank you for holding your breath. Okay, there are no bruits, whooshes, or abnormal sounds auscultated. Okay, now I'm going to feel your chest with the palm of my hand for any heaves or thrills. Okay, none are palpated. I'm going to begin the assessment of your chest by finding your point of maximal impulse, and that is at about the 4th or 5th intercostal space. So I'm going to place my hands on your chest and find your intercostal spaces with my fingers and count down. 1, 2, 3, 4. And I'm going to feel your point of maximal impulse with 1 finger. Very good. And I'm feeling for any bounding, irregular beats, any weakness or threadiness, and it feels, I can clearly palpate it with no irregularities. While my finger is here in the 5th intercostal space, I'm going to come back to your 4th and your 3rd intercostal space, and now I'm palpating for the border of your heart. And I'm going to also do this. What is that called? percuss to define the edge of your heart. I'm listening for dullness, which indicates that there is heart muscle underneath my fingers. And that is what I hear. Now I'm going to find your pulmonic area pulsation, and that is at the second intercostal space to the left of your midline. So 2, find the pulmonic pulse. Okay, I'm going to come across to the aortic pulse, which is on the other side in the same intercostal space, the second intercostal space. Okay, there's no bounding or threadiness. They are palpable with no abnormal beats. And then I'm going to come down to about the fourth intercostal space and find your mitral pulsation. Great. Now I'm going to use my stethoscope and listen with my diaphragm. First, just listening for S1, S2, any extra heart sounds like S3 or S4, and then I'm going to use the bell of my stethoscope to listen for any murmurs, okay? All right, I'm going to start with your aortic pulse. This is the second intercostal space. Okay, I can hear S1, S2. I'm going to move over to your second space on this side, which is your pulmonic area. Okay, I'm going to move down to your fourth and fifth intercostal space, which is your mitral area. Very strong heartbeat, no irregular heartbeats. S1, S2 noted, no murmurs. Okay. Now I'm going to listen with the bell of my stethoscope in those same areas, listening for murmurs. Can you go ahead and hold your breath for me? Okay, no aortic murmur is noted. I'm going to come over to your pulmonic area. Go ahead and, there you go, thank you. Okay, no murmur. I'm going to come over here to your fourth or fifth intercostal space and listen for any mitral murmurs. Okay, no murmurs are noted, no S3, S4, no irregular heart sounds. I'm going to go ahead and have you turn over on your left side slightly, just slightly. Go ahead and lay your head down. There you go. I'm going to listen again in your mitral area. This will help me to better auscultate any murmurs that I might not have been able to hear when you were on your back. And listen right over here again in the fifth intercostal space. First listening with my diaphragm. S1, S2. There's no S3, S4, or murmur noted. And I'm going to flip the stethoscope over and listen with the bell. Go ahead and take a deep breath and hold it. Okay, there's no whooshing or bruit or murmur noted in that position. And I'm going to have you sit up for me, please. Okay. And I'm just going to have you lean forward for me a little bit. There we go. And I'm just going to do the same thing, okay? Sometimes in this position we can get a better, hear a little bit better some of the extra heart sounds that we may have missed when you're on your back. I'm going to start over here in your aortic region. S1, S2, pulmonic. Okay. Your mitral area, which is in about your fifth intercostal space. Okay, S1, S2 is noted. There are no extra heart sounds, no S3, S4, and there are no murmurs. Okay, that concludes the cardiovascular assessment. Thank you very much.
You're welcome.
Mommy?